Did you know that Medicare providers may be overcharging you without you even realizing it? Let's find out how. Welcome back to our channel. Today we're diving into a critical issue that affects millions of Medicare beneficiaries: overcharging by Medicare providers. In this video, we'll uncover the reasons behind these excess charges, how they impact your wallet, and how Medicare Advantage and Medicare Supplement plans can help offset these costs. Understanding this issue is essential to protecting yourself from unnecessary expenses. Let's explore some common tactics used by Medicare providers to inflate charges. One tactic is upcoding, where providers bill for a more expensive service than what was actually provided. For example, billing for a complex procedure when a simpler one was performed. Another tactic is unbundling, where services that should be billed together are separated to increase the total cost. For instance, billing for each step of a procedure individually instead of as a single package. Providers may also charge for services that were never rendered or inflate the number of services provided. These practices lead to higher out-of-pocket expenses for patients, especially if they have to meet deductibles or co-payments. The impact on patients can be significant. Many people on Medicare are on fixed incomes, and unexpected medical bills can cause financial hardship. It's important to be aware of these tactics and review your medical bills carefully. So, what are excess charges? Excess charges is the terminology that allows providers to charge Medicare recipients up to 15% above their bill. A key note to take away is that not all providers partake in excess charges. Excess charges only applies to participants of Original Medicare and some supplement plans such as the Plan N. Excess charges are prohibited in Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont, regardless of the plan. These excess charges are often hidden in the fine print and can be difficult to spot. But there are ways to protect yourself. Medicare Advantage plans often have lower out-of-pocket costs and can limit the amount you pay for services by waiving these charges. Additionally, Medicare Supplement plans, also known as Medigap, can help cover these excess charges by paying the difference between what Medicare pays and what your provider charges. Supplement Plan F and Plan G does pay the excess charges. Understanding your coverage options and choosing the right plan can help you avoid paying more than you should. Now let's talk more about Medicare Advantage and Medicare Supplement plans. Medicare Advantage plans, also known as Part C, are offered by private insurance companies approved by Medicare. These plans cover all the services that Original Medicare, Part A and Part B, cover, and often include additional benefits like vision, dental, and hearing coverage. One significant advantage of Medicare Advantage plans is that they often have out-of-pocket maximums, which Original Medicare does not have. This means there is a cap on how much you will pay for covered services in a given year, providing you with financial protection against excessive charges. Medicare Supplement plans, or Medigap, work alongside Original Medicare to cover some of the out-of-pocket costs that Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Medigap plans can also cover excess charges, which, as we mentioned earlier, are amounts that a provider can charge above what Medicare approves for a service. By having a Medigap plan, especially Plan F or Plan G, you can ensure that you are protected from these extra charges. When choosing between Medicare Advantage and Medigap plans, consider your healthcare needs, budget, and preferences. Medicare Advantage plans can offer lower premiums and additional benefits, but they might have network restrictions, meaning you have to use the plan's network of doctors and hospitals. Medigap plans offer more flexibility in choosing healthcare providers, but might come with higher premiums. It's also worth noting that both types of plans come with their own rules, and it's essential to understand these rules to maximize your benefits. For example, with Medigap, you can see any doctor that accepts Medicare patients. But with Medicare Advantage, you may need referrals to see specialists and might be limited to providers within the plan's network. Education and vigilance are your best defenses against Medicare overcharging. Regularly check your EOBs, understand your Medicare benefits, and don't hesitate to ask questions or seek help if something doesn't seem right. The more you know, the better equipped you'll be to protect yourself from unnecessary healthcare expenses. Additionally, advocating for policy changes can also play a role in reducing overcharging. Supporting efforts to simplify Medicare billing processes and increase transparency can help reduce the opportunities for overcharging and fraud. Staying informed about legislative changes and participating in advocacy efforts can contribute to a more efficient and fair healthcare system. Finally, sharing your knowledge and experiences with others can create a more informed community. Discussing these issues with friends, family, and fellow Medicare beneficiaries can help others avoid the pitfalls of overcharging and ensure they receive the healthcare they deserve without excessive financial burden. To recap, Medicare overcharging is a pervasive issue that can lead to significant financial strain for beneficiaries. By understanding common overcharging tactics, reviewing your medical bills carefully, and choosing the right Medicare Advantage or Medigap plan, you can protect yourself from unnecessary expenses. Stay informed, vigilant, and proactive in managing your healthcare to ensure you receive the care you need at a cost you can afford. Have you ever experienced issues with medical billing? Share your stories in the comments below. Don't forget to subscribe for more updates and in-depth analysis on healthcare trends. Together, let's stay informed and empowered to make the best decisions for our health and well-being. Thanks for watching, and I'll see you in the next video.